Chair, thanks, gentlemen. Now recognize the gentleman from Utah, Mr. Matheson. 5 minutes for questions.
Thank you, Mr. Chairman, and thank you, Mr. Hackbarth, for being here today. It seems to me that one of the outcomes of your suggested change in this benefit design has something to do with overutilization and trying to address that issue in terms of having the individual patient have a little more of a consumer orientation. Mm-hmm. Is that a fair assumption?
Yeah, that's part of it, Mr. Matheson, but the most important part from our perspective is to improve the benefit package for beneficiaries, including catastrophic coverage.
I wanted to talk a little bit about a particular component of overutilization. I may be getting a little off the specific benefit design topic of this hearing, but I know in your MedPAC March report you identified some specific geographic areas where there is a strong reason to believe that certain inappropriate billing practices are at play in the home health care industry. And I've seen some data that's pretty phenomenal in my mind. I compare my state to Miami-Dade County. I got 190,000 Medicare beneficiaries in Utah. There are about that many in Miami-Dade County. However, there are 700 home health care providers in Miami-Dade County and about 100 in Utah. Home health services in Utah cost Medicare a lot less than the services performed in Miami-Dade. The average cost per enrollee in Utah is $560. The average cost in Miami-Dade County per enrollee is over 6 times that amount at $3,500. Strikes me that the vast majority of providers in the home health care industry in Utah are doing the right thing. And it strikes me something's going on in Miami-Dade County that doesn't pass the smell test. And it seems to me that it's an important issue for us to look at in how we try to seek out these pockets of geographic areas where there's this huge overutilization going on, and instead of doing a policy that may affect all providers, and those, including those that are doing the right thing, that we target those who aren't. So in the instance of home health care, I was wondering if would it be better for Medicare in terms of saving money and decreasing overutilization to scrutinize the issuance of new provider numbers or to look at reasonable limits on episodes of care in these high utilization areas like Miami-Dade County?
Yeah, there are 2 types of problems in home health care as we see it. But before I focus on the problems, let me emphasize that we think that home health care, good home health care, is an essential part of good quality care for Medicare beneficiaries.
Yeah, and I agree.
So in no sense are we against home health care. But there is, as you say, evidence that in some parts of the country we have extraordinary levels of use, an extraordinary number of home health agencies, and we think indications of fraud and abuse of the benefit. And we have made recommendations for targeted efforts to deal with those problems, including limits on the number of new agencies in those problem areas. So we think that's an important thing to do. Having said that, though, across the country, we believe, even in the low-use states, we are paying too much for each episode of home health care. So even where there isn't that fraud and abuse, we believe the rates are too high relative to the costs incurred.
In terms of this situation where you've got some certain geographic locations where there appears to be extremely high overutilization compared to a peer comparison elsewhere, is it reasonable to assume that this situation is occurring in other aspects of Medicare services in this country outside of home health care?
Well, quite possibly, yes. Another area where we see extreme variation is durable medical equipment. So post-acute care in general, which includes home health care and DME, account for a significant portion of the geographic variation that is the focus of so much attention in Medicare.
We feel like in our state we practice medicine in a way if the rest of the country did it, we'd be saving a lot of money with outcomes just as good. And so I think this is something, Mr. Chairman, I know it's a little outside of this benefit structure of this hearing today, but this issue of discrepancies in utilization across different geographic areas is something that I think is worthwhile for us all to take a look at and provide some real opportunity for some savings. And with that, I'll yield back.
Chair, thanks to the gentleman.